Guys, let's talk about some physical therapy today. So, today I want to focus on the importance of precision of movement, posture, alignment. These things we learn about in physical therapy school, and even the lay person can tell if somebody has a really hunched back, really poor posture, forward neck, or if they're walking and their gait just seems asymmetrical. Maybe one hip is externally rotated one way. They're just asymmetrical. Even somebody who doesn't study the body and the movement system can maybe unconsciously tell that person is going to there's a high likelihood that they're going to experience some pain due to their malalignment, their posture, and the way that they move. Okay, so let's kind of set the foundation there. There, in physical therapy school, we learn that there is proper posture, proper alignment, proper way to walk, symmetrical way to walk. So there's proper ways to move, and that there's a synergistic effect. So I think of the shoulder blade, right? The shoulder blade's a part of the glenohumeral joint or the shoulder. So you think of your shoulder here, but the shoulder blade actually does some of the movement to assist the shoulder, so that the actual shoulder joint doesn't impinge on the shoulder blade. The collarbone meets with the acromion, this bone here, the AC joint, that needs to rotate up as well so you don't impinge when you go up overhead. So that's just an example there. You can think of the hip the same way, right? You have the ball and socket, but there's also the pelvis bone, right? That's the socket, and the muscles act on the pelvis and the hip, so that there's kind of a synergistic type movement. So I'm just trying to lay a little bit of foundation for you guys. I'm sure you hear about core strengthening a lot, how a weak core can lead to some issues. Too tight of a core can lead to some issues as well. And that kind of leads me into my next point, okay? So my next point being is there's an optimal strength and stretch that your muscles should be on to move optimally. Okay, so let me put it to you this way. If strength deficits were the cause of weakness, so strength deficits meaning if weakness was the cause of somebody's pain, which it certainly can be a component of somebody's pain, but if we were to just say generally weakness is the cause of the pain, then exercise lifters and power lifters and strong men, they would never have any pains or anything, right? Or if we were to say that tightness, muscles being too tight, that's the cause of your pain. If that were the case, then yogi masters, they would never have any pain, right? And that's just not the case. So there's an optimal balance that needs to be in place, right? And this is where a physical therapist can come in, or I'm going to try to help you guys to kind of realize or to notice malalignments, imbalances in your body, because that's really where the key is to avoiding pain in your future. It's the way in which you move, okay? And so I want you guys to think about your posture, right? So think about what you do during the day, right? If you're working at a desk all day, you likely have your head forward, thinking about bringing that back, right? These muscles are likely weak, so we want to try to strengthen those muscles. Now, becoming aware of the way that your posture is all the time, pinching your shoulder blades back, right? Just correcting that form. Okay, pinching your shoulder blades back. Maybe I turn my head to the side. If you kind of look like this when you go to the side, right, you're not moving precisely. So going from here to just kind of tucking your chin slightly, picture an axis running through the top of your head and just spinning directly on that axis, right? training yourself. Something just popped up on the screen. A thumbs down. I'm getting a thumbs down right now. Maybe it was because I did this. No, nothing. Nothing showed up on the screen then. All right. Anyway, moving precisely, right? So what I'm getting at here, and this is the same way with the lumbar spine. So if you're twisting and turning like this, you're introducing some shearing load on the spine, right? And the spinal column comes all the way up to the neck, so you can kind of relate the neck and the lumbar spine. But maybe you're moving that way because you're tight in your thoracic spine, right? Maybe your neck can't fully rotate because there's no thoracic spine mobility, right? So maybe that's something to look at. Are you stiff in your upper back? Or are you overly active in your big upper trap muscles, your SCM muscle, the big muscle here, and you're not utilizing your deep neck flexors, your deep neck extensors, your deep neck rotators, right? Okay. The only way to activate them is by coming into precise posture and almost like less is more, right? Less is more. If you're doing too much, right, you're just going to keep activating. That's why your upper traps get tight. People's upper traps get tight because they're doing all the work, because the intrinsic, the deep muscles that are supposed to be assisting the upper traps, the extrinsic muscles, they're in a non-ideal position, likely. If you're out here, they're in a non-ideal position to even activate or function. So again, maybe it's those deep muscles, maybe it's your thoracic spine that's limited, things to take a look at. Let's talk about the lumbar spine, right? Or maybe we'll go down to the shoulder. So like we talked about earlier, is your shoulder blade stuck? Like, is your shoulder blade what we call abducted? Is it away from the midline? Do you maybe need to work on those muscles that squeeze it back? Because if it's away from the midline, you could get some instability in the shoulder joint and some pain. So making sure that you're real stable, these muscles here, making sure it's mobile too. Like maybe you're just locked up. Maybe the shoulder blade is stiff, right? So maybe some mobilizations, right? Just some mobilizations, moving that shoulder blades together, shoulder blades away, shoulder blades up, shoulder blades down, shoulder blades rotating. Make sure you're not getting stuck anywhere, because that could be your issue as well. Does one side feel tighter than the other? Maybe work that one side a little bit more, especially if that's the side you're getting pain on. But definitely look at both sides. See, are they symmetrical? All right, because if not, then there's an imbalance there. Do you have a thoracic? Are you a thoracic kyphosis? Right? Are you rounded over there? Are you a cyclist that bikes too much and your abdominals are just tight? Because if your abdominals are tight, if your rectus abdominis is tight, it's going to pull on your rib cage. It's going to pull you over like this. So some of the younger folks might be, well, anybody really, but likely it's somebody who's doing a lot of ab crunches, or too much ab work can be an issue as well as not enough ab work. So test out on yourself. See, try to stretch your abdominals out a little bit. Does that help your pain, right? Maybe it makes your pain worse. Then maybe you're too loose in the abdominals, but you'll be able to, once you get more in tune with your body, knowing what feels tight, right? Maybe it's your obliques. Maybe it's your abdominals are just too tight. Maybe your hips are too stiff. So again, something to look at is the hips. If the hips are too stiff, the lumbar spine, when you rotate, is going to have to do a lot more work in terms of mobility, because the hips are too stiff. So the lumbar spine, there's more instability at the lumbar spine because it has to be overly mobile as a compensation for the stiff hips. Maybe you're a yogi master and your hips are too loose. Maybe they're too loose and need to be stiffened up for more stability. In the pelvic girdle. So, and if you're a runner and you're noticing that your knee is caving in, likely your hip external rotators are weak. So if you notice that your hips are weak, try strengthening those up. So physical therapy is all about finding a weak, and when I say weak link, it might be weak, it might be tight, finding an imbalance. These are things that you can work on for yourself. These are things that you should do before you get pain, because what we know is that posture, malalignments, imprecise movement are all things that can lead to pain. So we can look at somebody and say they may already have pain, or there's a high likelihood that they're going to develop pain just based on the way their posture is and just based on the way that they move. Now, yeah, there's going to be that 1 or 2% that they just don't have pain throughout their whole life and they have this terrible posture. And that's kind of analogous to somebody who smokes a pack of cigarettes a day and they have perfect lungs, or there's always those outliers. But we want to control what we can control to avoid and stay out of pain, because that's easier than getting into too much pain and then trying to work away from there. But I know this was just a general kind of screen you can do for yourself, just some ideas to think about. But if you need some more specifics, again, this is not medical advice. Please go see your physical therapist. But this is just something to get you started, something to get you thinking about, getting you in tune with your body, noticing where there may be a deficit, an imbalance, and something that you can start to screen out for yourself. But if there's anything that you need in terms of specifics, I would be happy to get on a call with you, take a look at your posture, listen to what's going on with you, but there's so many other factors that need to be considered. Your line of work, activities, hobbies, things you like to do, your posture, the way you walk. So definitely go see your local physical therapist. Do it as a preventative thing before things get too out of hand, so that you can nip it in the bud early. But I hope this helps you guys, and take care.